College students were a cause for concern for spreading coronavirus this fall. But most colleges and universities in Texas actually had low rates of infection. And a group of students helped keep each other safe while creating the best possible environment. Austin Hickle is the student body vice president at SMU and one of the founders of the College Health Alliance of Texas. Austin, good morning, and thanks for being with us today.
Thank you for having me.
The Alliance consists of students from more than 20 schools. So how did it come about?
Yeah, so it really came about over this past summer. I'm the student body vice president at SMU, and I was serving on what was called the academic subcommittee of the president's Healthy Reopening Task Force. And so I was really the student representative to work with the faculty members to figure out really how in the academic realms in the classroom, how our semester would look. There were a bunch of different subcommittees that dealt with different aspects of the campus, but it was all focused on, how are we going to come back during a pandemic and ensure that the students, they receive an education that is up to the standards of SMU, but also they're safe, and we keep not only our community safe at SMU, but the broader communities and the families of the students. And so in those meetings, we came up with a lot of restrictions, a lot of different protocols, but really what I saw is it's going to come down to the student buy-in and students really saying, stepping up to the plate and understanding that, COVID is one of our generation's defining moments. And so I wanted to figure out a way that I could use my position on campus, but also expand that, of course, statewide, because this is not something unique to SMU. This is worldwide. And so I started reaching out to a bunch of different student body presidents and student governments from around Texas and kind of trying to come up with an idea for what we could do. And so in June, we launched the College Health Alliance of Texas, and that's now 24 schools, student body government, student body presidents and vice presidents who have come together for a multitude of reasons. Primarily, it's really to say, we're in this together, we understand and communicate that message. Some of the CDC guidelines and other things like that really say, look, we have to take this seriously. But also we've launched a research initiative where we did a statewide survey with a bunch of the schools involved, and we captured really systematically gathered information from the students on the campus and really how are you approaching the semester? What is it like being in a pandemic on campus? And has it not only immediately what are the effects, but what are the long-term effects? Have you changed your career goals? Have you missed out on internship opportunities? How is this going to affect us long-term? And with that survey and with that research, we will be conducting congressional panels and really bringing that survey and those results into kind of the public policy area and arena, because my generation is going to be affected by this pandemic for years to come. Currently, it's affecting our education, other things like that, but it really will change the outlook of our careers. And so we wanted to figure out a way not only to communicate the importance of stepping up to the plate and the importance of really understanding how significant this pandemic is, and that really the responsibility is in our hands for us to be on campus, but also to gather information and work together to figure out how can we have a voice at these decision tables and providing data at these decision tables for the policymakers and decision makers who are impacting our careers.
And as far as the wear a mask, wash your hands immediate side of it, what kinds of things did you on your campuses to get that buy-in?
Yeah, so two of the biggest things we did. The first thing we did was put together a student handbook, and so that was we all pitched in on that, all the different schools, and that was really a guide for how we would approach the semester. We published it right before the semester started, and that was made for students by students. It was ways that students could really engage with other students in a pandemic world. So meaning study tips for online classes, but also how to plan an event with 10 or less friends, other things like that, but also mental health resources, other things like that really only students can speak to. We hear a lot about the CDC guidelines and other things from our universities about what the protocols are, what the restrictions are, but we said, let's mention those. Those are in our student guide, but it's bringing things that really students can speak to, that we can speak to each other about. And that was more of the things, how to deal with loneliness, what to do in quarantine if you have to go to quarantine, and other things like that. And then the second thing we did communicate, we put together a PSA, and that was kind of an animated video that we had shared at a bunch of different campuses on our Instagrams and our student government Instagrams, as well as the actual university Instagrams and other social media platforms. Because of course, my generation primarily communicates through social media, so we really tackled that as well.
We'll have more with Austin Hickle after the break, including his thoughts on whether college students should go back to campus after spending the holidays back home. Stay with us on ETX Covered. We're talking with Austin Hickle, a leader of the Collegiate Health Alliance of Texas, about managing the pandemic on school campuses. Well, by and large, from your experience at SMU, how do you think everybody did this fall?
So it's been an interesting semester, and that's not only at SMU, that is for everyone. And students have been trying to find, not only students but everyone, how to finding a balance between staying safe and living, and especially for the freshman year students who had lived up or heard about the college experience and then get here and they don't have much of that. It was interesting to work with and hear from students on how they were dealing with that balance. I think students did well. I think they stepped up to the plate. Fortunately, none of our schools had to shut down like they did in the spring. And speaking, of course, of chat, there were schools around the nation that did, and primarily in elementary or high schools, but colleges typically were able to stay open. And I think that's partly due to the students stepping up, but also to the administration and how they enacted protocols and different type of scenarios that I think really helped. So it really came down to all of us working together. And again, it wasn't perfect. There were some times that cases rose and they're rising still. But I think really students did recognize that the responsibility was in their hands and they stepped up to the plate.
Well, you're back at home right now taking finals because SMU, like lots of other schools, kept all of its students home after they left for Thanksgiving. But you'll return to campus right after Christmas and New Year's, which are two big opportunities for community spread. So do you think bringing everyone back is wise, or should students stay home to start the spring?
Yeah, so I think if we apply the same metrics we did to this fall semester, I think it was relatively successful reopening the schools. Of course, that changes by the day because COVID is still rising. So we can bring into the equation the vaccine, which we kind of see the light at the end of the tunnel. However, I don't think that'll directly impact at least higher education for a while as we look at the protocol for how it's going to be administered. And so I do believe that SMU and from communications through through the College Health Alliance, the administration is again putting in countless hours to figure out how we can reopen in the spring. And hopefully it kind of goes as it did this semester and hopefully better. I think this semester was kind of the final test. Maybe not the final test, but we were able to, put together a lot of things this summer. And then we were able to enact them and work through them this semester. And I think we learned a lot this semester. And so next semester, we'll really be able to grow off that and hopefully change some of the policies that didn't work out and keep some of the policies that did.
Are there any areas where you still see students and administrators butting heads over best practices?
I wouldn't say butting heads, but I think there's a recognition of some of the gaps. And so some things are the in-class or the class experience. So how do we alternate between Zoom classes or Microsoft Team classes and in-person classes and attendance and things like that. But also resources for students. Again, as I mentioned earlier, the freshman year students, they don't have that college experience. So how can we kind of bolster some of the things that they can do besides things that they can't do? I think students are kind of tired of hearing, and that was one thing we try to do through chat, tired of hearing what you can't do and kind of hear some things you can do. So I think those are the areas kind of reanalyzing how the classroom experience can grow and increase and strengthen, but also, what can students do outside of class? And so those are kind of the areas that I think we're working on at SMU and through chat.
Well, you mentioned that this will be an ongoing project. So what do you hope to accomplish going forward?
Yeah, absolutely. And I'll tell you one of the projects we're working on now. That's primarily over, this holiday break is mental health. And so mental health is something that not only students deal with all the time, but it's been heightened during the pandemic, and loneliness, now that anxiety has increased. That's something we captured during our statewide survey. There's definitely a concern for that. And the resources that schools provided over the semester, of course, they helped, but I don't think they were enough. But even though they weren't enough, they were still there. But now what we're worried about is going back on this holiday break. Students aren't on campus, so they don't have those resources anymore. And so we're partnering with a foundation to launch a mental health hotline So students around the state can call in and give their information and talk to a volunteer, and then they will be paired with a mental health service that gives them the help they need. And so that's something we think will be very important going forward, not only for this break, but that's when we'll launch it. But that's a project we're working on.
Well, Austin, thanks so much for joining us today.
Absolutely. Thank you for having me on.